Everybody. My name is David Martinez. I have the great pleasure of being the Director of Capacity Building and Grants, as well as Civic Health here at Vitalyst Health Foundation. This is our monthly Vitalyst 101 session, a way for you to get to know more about Vitalyst and how we operate as a foundation here in Arizona. Today, I'm joined by my colleagues Michelle Goodthunder and Erica Foster, who will be watching the chat room and answering questions throughout the session. But we will have an open Q&A at the end of the webinar. All right. Before we get started, just a couple of housekeeping to make this as accessible as possible. We have, if you need Spanish language services, we have that available. You could use the email conversemos@vitalysthealth.org. We have the closed captioning availability through the Zoom services. All lines will remain muted. We'll try to do that, but as I mentioned, we'll have an open Q&A so you can take yourself off of mute at the end of the session and we could be in community together. As I mentioned, my colleagues Erica and Michelle are watching the chat room for questions that come up during the webinar, and we'll be addressing them as they can, and then we'll state those out loud at the end so that we can get this in the recording. This recording and the slides and other materials will be shared to all those that registered for this webinar, and you'll receive those via email in a day or so. And all the materials will also be posted on the vitalysthealth.org partnering with Vitalyst webpage that you see on the link. If you'd like, you're more than welcome to introduce yourself, where you're zooming in from today, and what organization you represent in the chat room. So we use this opportunity just as an opportunity, like I mentioned, to introduce Vitalyst to folks who may not be aware of what we are. We are a Phoenix-based but Arizona-serving health foundation. We have a vision that all individuals and communities in Arizona are healthy and resilient. And to do that, we have a mission that connects, supports, and informs efforts that improve the health of individuals and communities throughout the great state of Arizona. While we are a health foundation, we see health as more than just health care. We look at the broader social determinants or social indicators of health. We call them the elements of a healthy community. You might have seen the wheel, as we affectionately call it, that represents these various aspects that we consider health. We know that health is in all policies, and you can see the variety of ways that health is reflected throughout the social indicators or the elements of a healthy community. You may not see yourself immediately in one of the spokes of the wheels, but trust me, you probably will if you take a deeper dive. And again, we'll send the materials out afterwards that you can go deeper into each of these spokes and see the specific health outcomes and different variations of what could be considered in each of those spokes. We use this as the initial determination of mission alignment. So if you see yourself and your efforts in this wheel, that you generally might be mission aligned. At Vitalyst, we hold an equity lens in all of our work as well. So you'll see that kind of cross-sectionality there in the middle of the wheel, as well as opportunities to build resilient Arizonans and communities. So we look at the intersectionality of these elements of a healthy community. You don't have to tackle all of these. You might just be in one or two of the spokes of the wheels. But again, this is the first kind of test of mission alignment with Vitalyst. I like to say Vitalyst has three sides of our house. We have our competitive grant making process, which I'll tackle in just a little bit. We have our priority goal areas, which I'll talk in just a moment. And then we have our fiscal sponsorship program called the Technical Assistance Partnership of Arizona, or TAP-AZ. I won't take a deeper dive into TAP-AZ because my colleagues with that team do a similar monthly 101 session. So if you'd like to know more about all of the services that are offered through fiscal sponsorship, primarily that back office finance and accounting support, but greater kind of shared back office services, you could go to tapaz.org, that's tapaz.org, and learn more about fiscal sponsorship, how that might be a great service, especially if you are a startup or growing entity that might need that, again, back office finance and accounting support. If you go to tapaz.org, they have a similar monthly 101 session where you could learn more about fiscal sponsorship. But to kind of go back to the programmatic priority areas at Vitalyst, um, we work as a health foundation in an upstream way to tackle the root causes of Arizona's greatest health disparities. We know that that takes a village, so all of our work is focused on supporting collaborative networks. And at the same time, though, we recognize that those collaborative networks are made up of community partners themselves that need to be strong, especially again as we hold an equity lens in that approach. That upstream intervention often involves some sort of policy or systems change. And as a public health foundation, that is a key component, a key goal of our work too, to inform decision makers across our programmatic priority areas and our systemic change efforts. So these three goal areas are aspects that you'll see in all things Vitalist. They especially are seen in our programmatic priority areas that you see here on the slide. As I mentioned, we have a competitive grants process as well as programmatic priority areas. So they are two separate things. So even if you do not fall within the three programmatic priorities, you can still qualify for the competitive grants process, which I'll go much more in depth to in just a few slides. But as a health foundation, we prioritize some of Arizona's most pressing issues, and those three for this year and for quite a few years now are civic health, healthcare integration, and housing. So in this instance, we have directors at Vitalyst who oversee each of these priority portfolio areas. So I oversee the portfolio called Civic Health, which is how people come together to tackle their toughest challenges. And in our case, as a health foundation, work to improve the health of their communities. But we know that sometimes there are systemic barriers, government institutions that and policies that are put into place that make that difficult or downright impossible. So our civic health focus areas are supporting collaborative networks that are ensuring that Arizonans have the ability to get counted in the census, ensure their voices are heard during the redistricting process, and that their voice can be heard at the ballot box with inclusive voting policies. So as I mentioned, we have those three goal areas: collaborative networks, strong community partners, and informed decision makers. So in our civic health portfolio, I connect every year, and as do my colleagues in the other portfolios, with community partners to outline strategies that reflect each of those goals. So in our civic health portfolio, the collaborative network that we support is called One Arizona, a roundtable of about 30 grassroots community-based organizations that are working in those systemic areas of census, redistricting, and voting policies. We still strengthen community partners, the second goal, by supporting a group called Instituto, which is a capacity builder for the movement ecosystem here in Arizona. And we do a lot of work to inform decision makers, especially it being an election year. And there are attempts to restrict an Arizona's ability to register to vote and to vote early or vote in vote by vote centers in the state. So we're really active on the advocacy front. My colleague Anna Rossetti, who you see next to me there, is the director that oversees our healthcare integration portfolio. This really is about the intersectionality of and the integration of the physical, mental, and social determinants of health. Anna's primary focus right now, because of the implementation of the federal HR 1 legislation that cuts Medicaid and SNAP, among other things, her collaborative network called Cover Arizona Coalition is working primarily to mitigate the impacts of HR 1 implementation that we know that we're already experiencing here in Arizona, with 400,000 Arizonans losing their SNAP nutrition benefits. And the next year, when the restrictions come into play for Medicaid cuts and work requirements, we are anticipating even deeper impacts. But Anna's portfolio is much broader than that. It looks at the broader social determinants of health, especially the public health impacts and the greatest health disparities here in Arizona. So she does a lot of work around healthcare workforce, strengthening those community partners, strengthening community partners and collaborative networks working around children's and maternal health, which is, again, one of the greatest health disparities here in Arizona, especially in rural, tribal, and Black and African American communities. And Anna, in her role, directs all of the state health advocacy and policy for Vitalyst. So we leverage our voice in a lot of ways at the state capitol on issues that impact in Arizonans' ability to live a healthy life. Our colleague next to Anna is Gabriel Jaramillo, who directs our Housing and Healthy Communities portfolio. Obviously, I don't think I have to tell anyone here, there's a housing crisis, certainly throughout communities here in Arizona and the country. And it's an issue that Gabe is tackling head on with the collaborative network called the Arizona Housing Coalition, especially showcasing promising practices in especially workforce affordable housing, leveraging what we call anchor institution properties like schools, colleges, health centers, churches to be mission aligned and leverage their property to and connect with nonprofit affordable housing developers to develop more housing supply here in the state. Gabe also does a lot of policy and advocacy around housing to ensure we have government funding for our housing trust fund and other policies that are around planning and zoning that restrict housing throughout Arizona. And last but not least is my colleague Sergio Paris, who's also on the call today. He directs our strategic communications for Vitalyst and tells the story for Vitalyst and our great partners. But he specifically focuses on any partners that come through our responsive grant making side of the house around educational systems and food systems, especially based on his experience in the nonprofit and philanthropic sector in those spaces. So that those are the programmatic priority areas of Vitalyst. So we have different strategies that again each director oversees and leverages non-competitive grants aligned with those strategies. We do a lot of other things besides leverage grants in this area, like utilize our time, our research, our convening power, our advocacy, our communications to focus on those programmatic priority areas. But again, if you do not focus on those three areas, don't fret because our responsive or competitive grants process is more of an open door policy where organizations that are working to support collaboratives that are working to advance systems change, again, tackling the root causes of the greatest health disparities in Arizona, can explore one of these grant opportunities, again, that is more reflective of the elements of a healthy community will. I'm really excited because this is the first monthly Vitalyst 101 session of our new fiscal year. It's our 30th anniversary at Vitalyst. So while it might seem that I'm wearing a casual shirt, it's our 30th anniversary State 48 shirt. Proudly wearing it, especially because our board recently approved an increase in our grants program in total, which is awesome, and all to celebrate our 30th anniversary. So in total, we have a three-tiered grants program that you see here, the Technical Assistance Grant, the Spark Grant, and the Systems Change Grant. In total, it's a 5-year grant potential of up to $230,000, which is awesome. We heard tremendously from grant partners and community folks saying system change is hard work. We need more time. We need more funding. And we listened and we increased our grant amounts to reflect that. So the totality is 5 years, but each the technical assistance grant is 1 year, the Spark grant is 1 year, and the systems change grant is 3 years. So I'll take a deeper dive into each one of these so you can get more of the concept of the criteria and the process to discover alignment with those. I say discover alignment because we have an open door policy here at Vitalyst Health Foundation. We created what we call the discovery intake form to discover partnership. So as you're going through this webinar and determining if your efforts are aligned with Vitalyst grant partnership opportunities, you would go to the vitalysthealth.org website. There's a grants and partnership link and determine or do a little bit more research, determine that alignment, and if you see alignment, complete that discovery intake form. It's not the official grant application. It is simply the kind of a letter of inquiry, if you will, or an LOI or an interest form to say, yes, I think there is alignment. I want to discover partnership. So the first step to discover that partnership is to complete the discovery intake form on our website. You'll have the opportunity to briefly share about your project, your collaborative, and how you see that alignment. We then receive that discovery intake form, do an initial review, and if aligned, you'll then be prompted to schedule a time to chat with one of the directors at Vitalyst Health Foundation based on what issue area you're focused on. So if you're trying to improve the housing system here in Arizona, you would be connected with our colleague Gabriel to have a follow-up consultation call, a 30-minute virtual call, who then he can review the concept and determine alignment and follow up on next steps. So the key, if you see alignment, you would complete a discovery intake form that is open, and we can begin to have those initial consultation calls. So once you are kind of on that website and listening to this webinar and think, okay, which of the three grant types might I be prepared for? It really does depend on where your collaborative is at on their journey towards systems change. So it's kind of a scaffolded grant approach. So if you're just at the beginning of your systems change effort, and maybe not even have formed your collaborative yet, you would most likely be aligned with the technical assistant grant, which is meant to be a collaborative capacity building grant for you to tackle one or more of these technical assistance needs you'll see in this kind of honeycomb format. So it might be needing to kind of build up your collaborative and engage those interested stakeholders. Or even if you do have those initial groups, you need to build this culture of trust, which is so important when you're working in a collaborative. Maybe identifying a little bit more about the robust leadership, a shared leadership concept, and resourcing the collaborative and your efforts overall. So this honeycomb visual is a new image that we have to better define what kind of technical assistance and capacity building support can be covered with the technical assistance grant. The technical assistance grant, very similarly to the Spark grant and the systems change grant, has these core criteria. So it's all the same criteria. It just, again, depends on where you're at in your journey towards systems change. So for this instance, the technical assistance grants, you're at the beginning. So you are barely building your collaborative and the capacity building to tackle the systems change. So you do have to be working with a systems lens and a systems thinking, but you don't have to know your specific interventions or solutions yet for the technical assistance grants. But you do have to be understand your work as wanting to change a system. The collaborative, again, you're at the beginning of your journey. So in this instance, technical assistance grant can be a singular lead applicant that can be a nonprofit or fiscally sponsored entity that is serving Arizona, and at the very least have the idea of who your partner should be. When we think about what makes a strong collaborative, we look at the right partners and the right roles, quality over quantity, especially when you're thinking about what are the potential interventions or solutions and who are the people and the organizations, the partners that will help advance that. We are a health foundation. We're working to improve health and health outcomes. So that is a criteria for each of the three grant types as well. Again, we frame our community health outcomes using the elements of a healthy community will. So you can identify kind of what the specific health indicator or element of a healthy community you're focused on in that framing. The technical assistance grant is a grant of up to 1 year and up to $20,000 and a budget that is consistent with the proposed scope of work. So we say up to 1 year and up to $20,000 because often a technical assistance grant is leveraged to provide compensation for consultation or coaching support, support to help build the capacity and address a specific technical assistance need of your collaborative. That consultant, you would work with them to collaboratively draft a scope of work. Think about that scope of work, the key deliverables, the anticipated timeline, and the anticipated compensation that the consultant would need to help build up your capacity. You might have a smaller scope of work, a smaller time frame, so a smaller amount that is requested by the consultant in their proposal. So that might not eat up or go all the way up to the $20,000 rate. Or you might their proposal might be, say, 10,000, and you want to compensate community partners, account for the lead organization's time as well. So add maybe another $5,000 in there. So your request would be $15,000. So we could request those amounts. You just can't surpass $20,000. It's up to $20,000 up to 1 year. The process to determine alignment with the technical assistance grant, again, is through our online discovery intake process. So visit vitalysthealth.org, the Partnering with Vitalyst website. You'll have the opportunity to learn more and take a deeper dive into the specific criteria. I provided a very high level criteria aspects of it. But one of the things we have implemented this year is creating evaluation rubrics for each of the three grant types. And we like to say it's an open book test. So you know exactly what the grant reviewers are asking when they're assessing and evaluating the applications. And so long as you answer those questions to the best of your ability, the stronger your proposal will be. But that first starts with a discovery intake process. So you go to that website, complete the discovery form, we'll receive it, review it, and if aligned, you'll be prompted to schedule a time to chat with one of the Vitalyst directors I reviewed earlier. That is through a 30-minute virtual conversation, and to better understand what the effort is, how you see alignment with the criteria, and then follow up on next steps. In this stage, there might be some back and forth. They might receive a draft proposal to determine, yes, there is strong alignment, or your responses to, say, the system change criteria might be a little bit stronger. So strengthen it. I'll update it, bring it back to me, and then from there we can determine next steps. Once discovery is determined and that feedback is incorporated, if it is a fit, the prospective partner will be invited to submit that proposal uh, to uh, to be reviewed internally, and we reach consensus to fund or not to fund, or might have follow-up questions or feedback to strengthen the application itself. This is an internal review process that doesn't have to go to our board. So usually it's about a 2 to 4 week process for us to have that internal review process. So we review these ongoing throughout the year and award them as they come up for consideration by the team. So once you have built up the capacity of your collaborative, perhaps using the technical assistance grants, then hopefully you're in a better position to then apply for the Spark grant. The Spark grant is meant to be a planning grant to help that collaborative that has built their capacity to spend a good amount of time to plan what their specific interventions or solutions are towards systems change. So here, you'll see the criteria is a little bit more focused now because, right, your collaborative is advancing in the journey towards systems change. So at this point, you should have the planning design concept to actually think through with your collaborative, what are those specific interventions or solutions towards system change, and how can we build up this plan to strategically tackle that. In this case, for the collaborative, again, a little bit further in their formation. So it still has to be an Arizona serving coalition with 3 or more partners. That's the baseline. Again, we look at who are the right partners in the right roles, quality over quantity. But you have to have at least 3. Again, working to improve a health outcome. This also allows you an opportunity to get a little bit more focused on what those specific health disparities are. We hold an equity lens in all of our work. So just like with the collaborative, where we want you to engage community members with lived experiences, we often say those closest to the problems should be closest to the solution. That's holding an equity lens in the collaborative that we assess. And we also assess in the health outcome an equity lens based on those the disaggregated data, cited disaggregated data that allows you to focus on those communities or populations with the greatest disparities in health. And you'll see that health equity aspect criteria noted there. The Spark grant is a 1-year grant of now $30,000. Remember, we're celebrating our 30th anniversary. So this was an increase from previous years. And for the Spark grant proposal, you have the opportunity to provide a narrative of your budget, how you intend on leveraging $30,000 for your planning towards systems change. And we have a budget worksheet that you'll submit as a template budget as well. Very similarly to the technical assistance grant, the Spark grant is discovered through our discovery intake process. So again, you would go to vitalysthealth.org, our partnering with Vitalyst website, and if aligned, complete the discovery form. We'll receive it, review it, and if aligned, you'll be prompted to schedule a time, again, to have a 30-minute virtual call with a Vitalyst director. Um, as we as directors determine there is alignment, and again, there might be some back and forth with reviewing a draft proposal, seeing if there is actually alignment or determining if that application is as strong as it can be, they will invite you to submit that proposal through our online portal, and that kickstart our official review process. It begins with the staff discussion, and if it is decided that there is strong alignment, this then is, if we reach consensus to recommend for funding, we advance it for our board to consider. Because this is at the $30,000 amount, we have to get board approval. So while we review these opportunities throughout the year through our discovery intake form, we have specific grant cycles in which we can review them based on when our board meetings are. So this is really important because if you are invited to apply and submit your proposal for Spark grant, you have to go through our discovery process first. It's not like an open portal. You have to go through discovery in order to be invited to apply. The same is the case with the technical assistance grant. So in the fall Spark grant cycle, you have to complete a discovery intake form and consultation by September 25th to be considered to and invited to submit the proposal by October 8th. Similarly, for the winter cycle, the discovery has to be had by January 22nd, and then you might be invited to submit the proposal by February 4th. And then finally, we added a third cycle this year in the spring. Discovery has to be completed by April 23rd, and if aligned, you will be invited to submit your proposal by May 6th. Once you submit your proposal again, then we go through our board review process. We have a grants committee of our board that does initial reviews, and then they make a recommendation to our full board for ultimate ratification. Finally, the third tier grant, once you've built the capacity of your collaborative has done that planning, now you're ready to implement your systems change. So the systems change grant is meant to be an implementation grant that supports those collaboratives that have already built their capacity, they've done their planning, they're ready to implement the intervention or solution they have come up with for their systems change project. Because this is a 3-year grant of now $180,000, the criteria is a bit more specific. These are the highlighted criterias, again, the same for the other grant types, but much more in depth with especially ensuring that you have really thought through the project design for system change. What is the actual system change effort that you're hoping to advance? How are you ready to implement it and achieve it? In this case, the collaborative, you're further along in your journey towards systems change. You're ready to implement it, right? So the collaborative is formed. It's strong. You have the right partners in the right roles. You have built that trust, and you all are ready to advance systems change together. You still have to be working to improve a health outcome, of course. And again, this even allows you the greater opportunity to focus in on those specific populations and communities with great health disparities using cited disaggregated data. And then for this, the systems change grant is a 3-year grant of $180,000. You have the opportunity in your proposal to provide a budget narrative. And again, you will submit a budget worksheet that is a template that we provide. On that budget spreadsheet, and you can reflect upon this in the narrative, we understand that systems change is hard work. It takes a village. It takes a lot more than even a total of 5 years, let alone 3 years for implementation. And it takes a lot more than just 180,000 for the 3-year grant period. So we want our collaboratives to think about what is the total anticipated cost needed and highlight that in your budget, and then note any other funding sources that you might have secured or have committed or are seeking as part of this effort. The Next week, we will have the two information sessions specifically for the Systems Change Grant. The first one will be a quarterly series that we're introducing this year that is specifically focused on clarifying and building understanding of the systems change criteria. We understand that there's a lot of need in the community now and throughout the state, and a lot of those needs are more programmatic or direct service. That work is so important, but at Vitalyst Health Foundation, we do not support those efforts. We support systems change efforts, the upstream interventions that are trying to tackle the root causes of those problems that are leading to the symptoms of the downstream interventions. So, the biggest area of opportunity that we see with folks that come through the discovery process, for our competitive grants process is misalignment and or building greater alignment with the system change criteria. So next Monday, we'll have a specific workshop where we tackle exactly what we mean by systems change. And then Tuesday, we'll have an information session where we go over more of the logistical aspects of the system change grant, because it is a bit more of a thorough process because it's multi-year and $180,000. But to give you a primer, this is a visual that we use, and we, on our website, vitalysthealth.org, have a whole page on building understanding for systems change. We have a white paper, what we call a Spark report. We have webinars. We have other resources and visuals that help folks frame and build understanding of systems change. But this is the visual that we often turn to that frames when you have the most transformative type of systems change, you have met all 6 conditions that are noted on this. Of course, that's when you have the most transformative systems change that often takes many decades, many resources. We're not saying you have to tackle all 6. In fact, we want you to focus and better understand what is the impact we can make to advance our specific system change efforts in the amount of time we have utilizing the Vitalyst grant and the amount of resources with the Vitalyst grant opportunity. So you might just focus on one of the conditions of systems change, and that's okay. We actually really highly prefer that because we want you to be able to show strong impact and strong advancement in your systems change. But in totality, when you're trying to change a system, what all 6 of these are usually achieved. The upper tier is the most easiest or explicit conditions of system change because they're more of the tangible aspects of system change, right? So when you think about policy change, you can actually go to like the Capitol, right, or City Hall and say, pass House Bill number 1, or vote no on it or whatever. So it's very tangible. The same thing with practices or even resource flows, which we see a lot, especially with like Medicaid reimbursement or whatnot. It's when you get to these lower tiers, the semi-explicit and the implicit, where it's really much more difficult to frame as a condition of systems change. And this is where we see a lot of the disconnect, where people are like, yeah, we are building relationships and connections, but it really is important for you to better understand what that actually means as a systems change, or very similar to the power dynamics, and certainly mental models when you're actually like changing hearts and minds. So again, I invite you to check out the vitalysthealth.org website that is building a better understanding of systems change, and invite you to attend our live webinar next week where I take a deeper dive into systems change. We'll have that recorded and posted on our website as well, so don't fret if you can't make it. We just wanted to provide a quick high-level overview of how we help folks frame systems change. The review process for system change grant is very similar to the technical assistance grant and the Spark grant. We highly encourage folks to go through the discovery intake process to really determine if there is alignment. For the systems change grant, however, you do not have to go through the discovery intake process. You can submit your proposal directly to an online portal that will open up next week and not go through the discovery intake process. However, we highly encourage partners to go through the discovery intake process to have an open and frank conversation and better determine alignment. Because one, we don't want you to waste your precious resources on writing a grant that is immediately known not to be aligned. If you're not sure if you have alignment or not, go through the discovery intake process because my colleagues, we're nice people, and if there is alignment, we want you to submit the strongest application possible. So it's only to your benefit to go through the discovery intake process and have that initial conversation. And then from there, again, once you submit a discovery intake form, you'll be prompted to schedule a time to chat via virtual Zoom meeting with one of my colleagues. Um, if discovery is determined and there is strong alignment, or even if you just go through the online portal without going to the discovery, the proposal submission is 4 pages and a budget spreadsheet that is reflective of those criteria. Once we have those submissions by the deadline, it begins our internal review, including engaging our board grants committee to review those. So we have an internal team that does an initial review to see which of all of the submissions we get meet the baseline criteria. Then we advance those that meet those baseline criteria for a full team review, again, using an evaluation rubric that is public. It'll be posted to the website. And then we take those scores from the rubric and select semifinalists that have the strongest proposals and invite those to present their proposal to our Vitalyst team and our grants committee of the board. That presentation is a 30 minutes virtual where we invite you to tell the story of your project, not regurgitate what you submitted with the written proposal, but tell your story in a different way. We do this kind of two-step process as a way to hold an equity lens in our grant making. We work with a lot of grassroots community-based organizations, and we're certainly open to working with more grassroots community-based organizations, but recognize they may not have a full-time grant writer, a development officer, a fundraiser. So their written application might not be as strong, but they sure can tell their story well. So that's why we have both the written application and the presentation component of our grants process for the system change grant. So then once we um, go through those presentations, we have an evaluation rubric for the presentation as well, and our team compiles the data both from the written application and the written application and the presentation, and then select which we are recommending to our board for approval. Again, the grants committee of our board reviews the staff recommendation and then considers that and advances it to our board for full ratification. This is an annual grant cycle because of the amount and because of the much more thorough process. So proposals for the systems change grants this year are due October 29th. If you do go through the discovery intake process, which again, we highly encourage you to, you have to have conducted that by October 16th. And then submit your proposal by October 29th. So that was a very quick, broad overview of Vitalyst Health Foundation. Again, our focus on our programmatic priority areas of healthcare, housing, and civic health, which have its own strategies, funding, and efforts that Vitalyst leverage beyond financial resources. Our fiscal sponsorship program, TAP-AZ, which you can learn more about at tapaz.org, and our responsive grant making program that is geared to support the capacity building of collaboratives, the planning for collaboratives, and implementation of the systems change by those collaboratives. I've stopped share now, and we have about 20 minutes or so for some Q&A. I will if you have a question, feel free to use the raise hand function and we'll call on you. But first, I'll ask my colleague Michelle or Erica to review any questions that may have come in from the Zoom room or through the registration link that we want to answer live.
Most of the questions in the chat have, or actually all of the questions in the chat have been answered, so we can probably go to the registration questions.
Okay. Were there any questions in the Zoom room that we might want to highlight aloud for the recording?
Oh, so there was a typo on the slide that said that the systems change grant was for 130,000. So we just want to clarify that that is for 180,000.
Oh dear. I got too excited about our 30th anniversary. That is now a 3-year grant of $180,000. Thanks for that catch.
I'm looking over the registration questions right now to see.
No worries. And while we're waiting for that, if anybody wants to come off of mute and ask a question, you're more than welcome to. You can use the raise hand function or simply unmute yourself and we can be in conversation and community with each other. A couple of things that I'll note. While folks are thinking of questions, and our team is kind of reviewing questions that came in through registration. One thing I do want to clarify is while we have a 3-tier grants program, you do not have to start at square one. So if you have built the capacity of your collaborative, you're ready for planning, jump straight to Spark Grant, right? Or if you've built your capacity, you've done your planning, you're ready to implement, you could jump straight to the systems change grant. You don't have to start at square one. It really depends on where your journey is at towards systems change. And that's what the discovery consultation call is helpful with because you might think, yeah, I'm ready to implement. I want to go for the system change grant. But in that conversation with a director, we will ask questions about the strength and readiness of your collaborative. Again, really look at the evaluation rubric and questions we have and say, well, you still need a little bit more capacity building for your collaborative. So let's start there, and then we can elevate up as it makes sense. Oh, Michael, I saw that's your question. Perfect. Great question, Michael.
And
And
then we
Callie
have,
asks, how many awards are given in each category annually? Okay, I knew I was going to ask that and I had it down, but can't remember. I know for the system change grant, it is our most competitive grant. We have 4 grants for system change grants currently budgeted. Um, to give you a perspective of what we have seen in total submissions to note kind of the competitiveness of it is we have historically seen anywhere between 40 to 80 applications. So it is very competitive. So 4 applications for the system change grant. For the Spark grant, I believe we landed at 10 grants for this fiscal year. And maybe Erica, if you can quickly go to budget visualization and just confirm that. I think that we have budgeted for 10 of those. And then for the technical assistance grants, this one is a little bit more difficult to say how the specific amount because the specific number of grants because while we have a total bucket of funds, not everyone is requesting $20,000. It again depends on what your specific capacity building need is of your collaborative. So the grant amount might be smaller, which means that in total we'll have more grants. I think where we landed with our technical assistance grants was about 8 or so for our fiscal year. Those might seem small, and we are a smaller foundation, but it doesn't mean that you have to rush to complete a discovery intake form and try to get in early in our fiscal year. We really do be intentional with kind of how many we advance initially, if there is really strong alignment, and if there's not, maybe just wait until the next quarter or the next cycle. So that is really important when we're thinking about the awards, the amount of awards given annually. We run on a July 1 to June 30th fiscal year, so that can give you an idea of, and you see that with the grant cycles as well.
And then David, we have actually budgeted for 7 Spark grants and around 8 technical assistance grants, but as you said, that there's that flexibility.
Cool. Thank you. Um, Karen, if I'm saying your name correctly, apologize if I don't. My program is looking into applying for one of the Vitalyst grants. However, I do have a couple of questions. Have you funded an ECHO program? If it's the same kind of model ECHO program, you can go to vitalysthealth.org to look at our previous grants awardees. A Project ECHO grant based out of a collaborative based out of NAU was supported last year. If the grant was received, would yearly meetings or discussion occur with Vitalyst to make sure the grant program is being maintained? Yes, actually, my great colleague Erica manages our partner engagement. We have mid-year and annual reporting cycles. We have generally quarterly learning sessions, and we have an open door policy. So as you're experiencing any challenges or want to troubleshoot some opportunities you're experiencing, we welcome the opportunity to connect. We want you to be as successful as possible in your grant period. We want to show you all the love without smothering you either. So definitely provide a lot of partnership stewardship. Brilliant, Karen. Yeah, I think it might be wise to go through the discovery intake process for your specific questions around like your ECHO model with cancer prevention collaboration with CHRs, CHWs. We have done a lot of work with CHRs and CHWs. So I would go to the discovery intake form and begin completing that, and we'll review it to see if there is alignment and then follow up on that. Michelle has a question. What steps do newer organizations need to have in place prior to getting TA funding or technical assistance funding? We at Vitalyst have a very, I would say, low bar, but doesn't mean we don't hold our partners and ourselves accountable for the funding because we are a public health foundation. We are accountable to community. But we pride ourselves in being able to work with really grassroots community-based organizations who may not be like have a lot of infrastructure or be institutional partners. If you are kind of a smaller organization that doesn't have a lot of things in place that would make you a successful system change effort, this is where the collaborative comes into place because maybe you're not the lead applicant if you don't have, say, all of the financial infrastructure to manage grants. So maybe you connect with a collaborator, a partner that wants to help you advance your system change and can play that role. And then, as I mentioned in the budget, you can develop your budget to compensate partners in an equitable way or a way that makes sense to account for people that have stronger roles or are taking a bigger responsibility of part of that collaborative. And again, this is where the discovery call comes into place because we really do want to, if there is strong alignment, to get you to a point of having the strongest application possible. And we actually are trying to this year engage with more grassroots community-based organizations, not just larger institutions. So definitely want to learn more about your effort. Michelle, any other questions that came in from registration that we should highlight?
No, the other questions are really specific, so people with those questions should complete the discovery intake process so they can talk with someone one-on-one.
Sounds good. Any other questions that folks might have and to address live? All right. Maybe the gloomy day here in the dusty day here in the valley has everyone a bit more calm. Yeah, thank you so much for all the gratitude. We host these sessions monthly. This is our kickoff to our new fiscal year and the launch of our new grant cycles. As I mentioned, this recording, the slide deck, the corrected slide deck, all the materials we talked about will be shared with all the folks that registered for this webinar. It'll be posted to our website. If you go to vitalysthealth.org or partnering with Vitalyst website, you'll also see the registration links for the information sessions specifically for the systems change grant. That'll be due, or that'll happen next week. And as you saw, is due October 29th. We highly encourage going through the discovery intake process for that as well. Karen has one more question, and we have 10 minutes, so I can read it. So the discovery intake form is to connect a program looking into funding and connect them with a specific type of grant, followed by being able to ask questions regarding the grant. Yes, absolutely. The discovery intake form is not the grant application. It's simply an initial um, kind of overview of your collaborative, your effort, your systems change alignment as you see it. And once we receive that form, if aligned, you'll be prompted to schedule a time to chat with a Vitalyst director who goes through a bit more of those questions, insights to determine alignment. And if there is alignment, then follow up with next steps and invite you to submit the proposal. It's kind of like a pre-grant screening to really determine alignment, especially alignment with the systems change criteria, because it is such a unique and niche grant type that we have at Vitalyst. So if your effort is more programmatic or direct service, it is generally misaligned and would not qualify under that criteria. But that's where we have that essentially the pre-grant screening using the discovery consultation process. All right. Any other live questions? You don't have to be shy. If you do have more specific questions, especially around alignment with your project, again, we encourage you to go to that discovery intake process, even for the system change grant. Great. Well, that wraps it up for us. Thank you so much for joining us. And yeah, thank you, Sarah. The discovery intake process isn't meant to be laborious or an additional step to accessing a grant partnership opportunity. It really is to help determine alignment, and if strong alignment, to get your proposal as strong as possible. The discovery intake form should probably not take you more than 5 to 10 minutes. If you're spending more time on the discovery intake form, you're probably providing too much information than what we need for that initial conversation. Yeah, thank you, Sarah, for that note. If you do have any other questions, again, we'll follow up with an email with all of these materials. We have grants@vitalysthealth.org set up as well if you have any initial questions. But again, if they're really specific to your project and determining alignment, we encourage you to go through that discovery intake process. Thank you so much for joining us for the first Spark Partnership Vitalyst 101 webinar of our fiscal year. We look forward to being in conversation with you through our discovery process and as we go through our grant cycles for our new fiscal year. I hope everyone has a safe and healthy day.